Hi, welcome back. Here, today we are with an Nclex priority question. This is about the COPD. This COPD small mistake will make you fail in the Nclex examination, and it is a very high yield priority. So let's go into the question. The scenario says a patient with COPD is admitted with pneumonia. Assessment findings says respiratory rate of 32 beats per minute, use of accessory muscles, a patient is in tripod position, SpO2 of 89% on room air, and ABG report says pH of 7.31 and PaCO2 of 60 mm of Hg and bicarbonates of 30 millicoulomb per liter. Which action should the nurse take first? And the options here are: A. Administer IV antibiotics, B. Place the patient on non-breather mask, C. Encourage pursed lip breathing, and D. Prepare for endotracheal intubation. So think which would be the correct answer? Yes, the correct answer here is C. Encouraged pursed lip breathing. Why this is very important is because the patient has a chronic respiratory acidosis with a metabolic compensation, which is shown in the ABG from the question. So the pH is very low and the bicarbonate is elevated, and the chronic COPD patient where 89% of saturation is expected, and the target of this particular patient is 88 to 92%, and this is within the normal limits. So we are going to see why the other answers options are wrong here. Is because A. Antibiotics, it is important of course, but it is not important to be started at this particular point of time. First the management has to be done first. And option B, that is non-rebreather mask, this is not correct because it can knock out the hypoxic drive of the COPD patients, and the patient will lose the drive to breathe. And on option D, that is intubation, it is only if the patient is failing to breathe and the patient is unconscious or a severe hypoxic condition, then only we are going to intubate the patient. Next, the important Nclex rule to remember is if a patient with COPD and distress, breathing techniques has to be tried first, not the high flow oxygen. Yes friends, unless the saturation is very less, that is less than 88%, or the patient is crushed. Okay, thank you and happy learning.